Hello and welcome to another quick blog summary video for the Cancer Physio. Today's topic is one of the most common symptoms I hear about for people that are in the prehab phase, in the thick of treatment, in the recovery phase, or even in the return to work phase. And that is people that are struggling with cancer-related fatigue. So today's blog is a long time coming and I've been speaking about doing this for a while. So thank you for your patience and I look forward to sharing it with you all. So today we will be covering this concept of cancer-related fatigue. And as you know, cancer-related fatigue is much more than just being tired. So for those of you who have been often told if you just sleep more or muster up a bit more motivation, a lot of those A-type kind of personalities think if I just put my mind to it, I should just be able to do more. Cancer-related fatigue is a little bit different than normal fatigue that often responds well to a deep sleep or a good night's rest. Cancer-related fatigue is a bit more complicated than that. So we're going to talk about that today. So how do we manage cancer-related fatigue? What are some evidence-based tips to help those with cancer-related fatigue regain energy? Well, first let's define it. So cancer-related fatigue, we're just going to call it CRF for short here. It is the most common and distressing side effect of cancer in addition to cancer treatment. And it is more than just being tired. Up to 80% of those with cancer actually experience fatigue at some point pre-treatment or during treatment, and 1 in 3 survivors actually report ongoing CRF. This can really greatly limit your ability to return to work, your activity tolerance, your exercise tolerance, and just your general quality of life. The symptom is often greatly underrecognized and greatly misunderstood. So what is cancer-related fatigue? Well, it's defined by the National Comprehensive Cancer Network as a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness related to cancer or cancer treatment. And it's not proportional to recent activity and it interferes with usual functioning. So I like to make it a little bit simpler and use the words head, heart, and body. You can see that in the diagram here. So fatigue can be triggered by tasks and affect tasks relating to the head, the heart, and the body. So in other words, the head, which is the cognitive, the brain, the body, which is the physical body, and the heart, which is the emotional well-being. So we know that all of these systems in the body have a baseline, and they can normally handle a bit of stress, and then they adapt. A healthy body can actually receive kind of deposits such as a good sleep, and then kind of return back to baseline. But someone with cancer-related fatigue can be greatly impacted, obviously, by a cancer journey that affects their baseline. This is when those typical deposits are no longer effective. A good sleep, a little bit more rest, those deposits aren't really effective. So we talked a little bit already about this, but that's why cancer-related fatigue can't really be cured by just sleeping more or summoning up more motivation. CRF really differs from ordinary tiredness in that way, and it can last for months or years and affect the head, heart, or the body. So we know that as humans are made up of these 3 systems, physical, cognitive, and emotional, it's important to start to kind of think of life and tasks in those 3 categories. I like to use this analogy. You guys have probably heard it before. Imagine your body as a bank account. And if you start to have all these withdrawals, chemo, radiation, surgery, the emotional distress of thinking about mortality and a cancer diagnosis. These are all huge withdrawals from your bank account. Now that bank account starts running at a deficit. So that's almost like a little bit of a new baseline. And what typically would act like deposits are no longer effective. So what can we do? Well, deposits with cancer-related fatigue can take the form of understanding cancer-related fatigue and establishing a new baseline. And over time, we can kind of think of the head, heart, body tasks, and from that, reduce the capacity in those areas. What we observe often is that baseline starts to increase. And in other words, the account balance starts to rise so that you're no longer running a deficit, but this can take time. So what causes cancer-related fatigue? We know that the cancer diagnosis itself can cause it. medical issues associated with the cancer diagnosis, hormonal changes, sleep disorders, hormone therapies in breast cancer treatment, cancer treatments themselves, chemotherapy, radiation, etc., post-surgical fatigue, post-radiation fatigue or radiation-induced fatigue, and then psychological distress, of course, and work-life kind of stress, heavy cognitive demands like high cognitive functioning like paperwork or just simply work demands, and then deconditioning, loss of muscle mass, loss of stamina, loss of poor nutrition. All of this can impact CRF, so it's very multifactorial. So what are some mental models that work? What we've observed that's really important is to start to use the concept of effort rating. So whether you're thinking of a physical task like walking around and running errands, or a cognitive task like filing some paperwork or completing some paperwork, or a heart task or emotional task like having that hard conversation with that family member, you have to think about these different areas of your life and kind of think about the effort that might be involved. And what we often talk about is first you start the effort rating and then you plan. So if you know a day ahead might have really high effort rating in all of those areas, that might be a day that will kind of cause some push crash. And we really want to avoid push crash. So we try to plan ahead and try to only have maybe one area at most that's a 6 or 7 out of 10 effort. And then in the other areas, we practice boundary setting or saying no, trying to keep kind of balance in the day to try and conserve energy. So this third principle here with the effort rating and planning then comes energy conservation. We're really trying to plan for those high effort tasks and choose what they might be. We're trying to use our good hours or kind of good energy cycles for this. We'll talk more about that in the next bit here. And we're trying to kind of break these tasks into steps and rest strategically, not excessively. Energy saving routines really include pacing and breaks, and we try to avoid kind of switching from one thing to the next, but having a little bit of a break in between switching contexts or switching tasks. The last tool or mental model that really helps with CRF, cancer-related fatigue, is knowing your pattern. This concept is especially important when undergoing chemotherapy because there's often a rhythm to energy cycles, where sometime in the week there is more energy than other days or hours in the day. Steroids such as dexamethasone, as we know, can be very stimulating. I'll have patients that say, I felt like I could go for a hike. It provides a lot of energy, but you still need to use that energy strategically, because you really want to avoid push crash. I always say push crash is very expensive. Push crash in the end is kind of like another withdrawal that lowers the bank account balance. So we want to kind of stay close to our baseline and try to avoid that push crash from occurring. So there's a concept that's happening with chemotherapy that's called nadir, and this is kind of occurring along this trajectory of cell kind of life and death. And so it is a little bit helpful to understand nadir so that you can kind of best optimize your patterns within them. Nadir is different for everyone in terms of its specificity, but it is a general pattern that most bodies follow. So you'll see that kind of during chemotherapy, there's a series of events that can happen as the infection-fighting cells are at their lowest level. The fatigue can be the highest. And this table here kind of breaks you through kind of what happens and why the fatigue might increase. Usually it's kind of day 7 to 14 after treatment that patients notice that they kind of have their worst fatigue because the steroids are no longer effective and the infection-fighting cells are at their lowest level. So your immune system is your weakest, which is also something to consider with precautions and exposure, but also you feel more tired than usual. So here's a free fatigue daily tracking tool you can download if you like. It's just a PDF that allows you to take some notes on a daily basis about different symptoms you might be having, but also kind of how your fatigue might be presenting. This can then allow you to better conserve energy, practice pacing, planning, and potentially even, like I mentioned, use this kind of tool to better understand head, heart, body tasks in your life and conserve energy around them. So here are some more tools we know that work. So above was more mental models, and these are kind of more just concrete tools. Well, we know obviously exercise is the most effective treatment for cancer-related fatigue. It sounds very counterintuitive because exercise is exertion, it is work. And this is true that if we don't stay within our baseline or we push crash, exercise can then actually not help fatigue. So it's all about keeping it light, the right dose, and having a personalized plan. So once again, fatigue tracking and effort rating can be very important when starting to exercise. You want to start very slow and build up slowly over time. Consistency beats intensity. I really love that rhyme. It's very true when it comes to CRF. The second tool for tackling CRF is to get support. It can feel very isolating, very frustrating, like people just think you need to muster up more motivation and stop being so tired. So cognitive behavioral therapy, some mindfulness techniques are all very helpful, and the literature has shown that. So consider having a counselor, psychologist during this time. Creating energy-saving routines and implementing some of the mental models that I spoke about can also kind of be high effort. So sometimes the help of a cancer physiotherapist can be helpful to kind of design a fatigue management plan, as well as how to exercise safely and effectively. Despite sleep not being the be-all end-all, it's still very important to prioritize sleep hygiene. This supports recovery. And we do want to consider, if you're having insomnia or really persistent sleep issues, that you do connect with your care team about that. So in my opinion, that's when CRF turns into something you really need to seek medical support with, is when your cancer-related fatigue is really affecting your daily life to the point where you have breathlessness, insomnia, or depression. That is when the fatigue is real and treatable, but it's very important to reach out to your medical team. So managing cancer-related fatigue takes a personalized and comprehensive approach, but with proper support, we really do see that most survivors regain strength and quality of life over time. And I've had patients that struggled walking around their house, and coming to the pool for a 10 or 15 minute water walking session took a year. But, recently, in the last month, sent me a photo of them hiking all over Ireland. So it's phenomenal, the change that can happen as long as the support is there and the programs are personalized to you. So just ignore that little icon. So key takeaway, cancer-related fatigue is very common, but it can be managed. So we're here to help you today with a personalized plan. Thanks again for your time and for your interest in science and rehab.